Hello everyone, and thank you for coming today. I'd like to start by telling you a story. On November 11th, 2021, my then 3-year-old son Lucas had a seizure. We took him to the doctor, and the doctor said that seizures can be isolated and that we should just wait a couple weeks to see how he does. About a week later, Lucas had a second seizure. This led us to visit a neurologist at Primary Children's Hospital. When we met the neurologist, they did some research to try to figure out why Lucas was having seizures. And a couple months later, we got the devastating news that our son was diagnosed with Battens disease. Now, many of you probably just thought, what is Battens disease? I know that was my first question for the doctor when I got the diagnosis. Battens disease is a genetic disease that is so rare that most doctors don't even know about it. I've been in countless emergency rooms and talked to many doctors. Whenever I meet a new doctor, I have to explain to them what Lucas's condition is because most of them don't know about it. So the important thing here is that if you don't know about the disease, you don't know how to spread awareness, and you don't know how to help. And that is what I want to address today. Since my son's diagnosis about 4 months ago, I've spent hours pouring through medical journals and research notes and asking doctors hundreds of questions in an attempt to understand my son's condition. Today, I'm looking forward to educating you all, whether you're here in person or watching the recording, about Battens disease, what the symptoms are, what the long-term outlook looks like, along with potential cures and the hope we have for the future. I will start by addressing the first question you probably all thought of, and that is, what is Battens disease? Battens disease is a common name for a set of genetic diseases where essentially patients cannot break down dead cells. The Cleveland Clinic states Battens disease is the inability of a patient to dispose of cellular waste due to their genes not possessing the correct lisosomes. As this cellular waste builds up in the brain, it starts to affect the nervous system. There are 13 types of Battens disease. Most of the symptoms of each 13 type are similar. The main difference is when the disease manifests itself or when symptoms start when they begin. There are some forms of Battens disease that start in adulthood, some that start in teenage years and young adulthood. There's even some that start before the baby is born. Unfortunately, all types of Battens disease are fatal, and there is no cure. My son Lucas was diagnosed with type 2, commonly referred to as CLN2. This is referred to as late infantile Battens disease, meaning it starts to manifest in early childhood. So how common is Battens disease and how is it contracted? As I mentioned earlier, Battens disease is inherited genetically. This is passed on when both parents have a specific genetic marker and both parents have to have it. Assuming both parents have the genetic marker, there is a 25% chance it will be passed on to the child. The other possibilities is that they will be carriers of the disease but not have the disease, or they will not be carriers and also not have the disease. The National Institute of Neurological Disorders reports the frequency of Battens disease is 2 in every 100,000 births in the United States. That is about 0.1% chance that a child will be born with Battens disease. Simply put, you're more likely to be struck by lightning than to be diagnosed with Battens disease. Lucas is one of approximately 200 known cases in the world of CLN2. And I'm going to say that again. Lucas is one of approximately 200 known cases in the world. That is how rare it is. What are the symptoms of Battens disease? And for this part, I'm going to specifically refer to CLN2, which is the condition that my son has. According to the European Journal of Pediatric Neurology, the average age of diagnosis is 5.2 years old. We got really lucky because Lucas was diagnosed at approximately 3.5. This meant that we were multiple years ahead of the average diagnosis age. Why is it that patients are diagnosed so long after symptoms begin to manifest? A big reason for this is that early symptoms of CLN2 look like epilepsy. They start with seizures and developmental delays between ages 3 and 4. Later symptoms are loss of motor skills, blindness, trouble with cognitive thought development, loss of speech, and eventually death. Without treatment, this will occur within ages 5 to 8, within years 5 to 8 of the child. I would like to take a moment and talk to you for a moment about what daily life is like as a parent of a child who has CLN2. Lucas has trouble sleeping. It's very common that he will wake up 1 to 2 times a night. This could be due to night terrors or restlessness. Just the disease kind of keeps him awake sometimes. Lucas cannot speak, and he will get easily frustrated when he can't communicate his needs. My wife and I have tried really hard to teach him sign language. We use pictures. We try anything we do to help Lucas to keep him communicating. Lucas does not play with normal toys the way a healthy child would. Lucas tends to obsess over certain things. Some of Lucas's favorite activities are basketball, but also vacuuming and garbage cans. We have actually bought little tiny garbage cans for him to play with, and he loves it. Lucas is prone to seizures, which means anywhere we go, my wife and I have to carry on rescue medicine in order to act if he has a seizure. He is on seizure medicine, which helps prevent seizures, but they don't completely stop them, so we have to be prepared for him to have a seizure pretty much any time. Right now, Lucas commonly has issues with balance and will fall over frequently. He also experiences muscle tremors and will sometimes injure himself while falling, so we have to make sure to watch him real close. Lucas will have muscle spasms, which will cause him to lose control of his muscles temporarily. But despite all of this, every time he falls or anytime he has a bad day, Lucas always comes up smiling. That's one of the things that I admire most about him. So now that you know what Battens disease is, I want to talk about the treatments and potential cures, and most importantly, what you can do to help us. In 2017, a drug was developed called Brineura, which is an artificial enzyme that will be administered into the patient's brain that will act as a substitute enzyme for the missing enzymes that the patient doesn't have. This medicine is administered directly to the brain through a port drilled through the skull, and it takes 5 hours to administer. For those of you with kids, think about trying to keep a 3-year-old sitting still for 5 hours. It's a tough task. These infusions take place every 2 weeks for the rest of the patient's life. The purpose of these infusions is to slow down the progress of the disease. This will help Lucas have a higher quality of life, as it will help save his mobility and his speech and cognitive thought, but Brineura currently does not help with blindness. Even though we are so grateful for Brineura infusion, we are so grateful we have a treatment, I would like to emphasize that this is not a cure. There is a cure in development, and this cure is referred to as gene therapy. Now, gene therapy is a word that essentially means, as defined by the U.S. Library of Medicine, the process of using genetic coding to override DNA. This is a really cool process, because essentially they can develop a gene, they use a virus-type method to insert it into the body. It's administered one time and essentially cures the disease. There have been types of spinal muscular atrophy that have been cured using gene therapy. So what is the current status of the cure for CLN2? Well, a company called Regenix Bio, based out of Maryland, is currently working on the cure for CLN2. It is called RGX-181. This drug is currently in the mouse testing phase, and it is being worked on by this company. However, the FDA has blocked the cure from progressing any further. The next step of testing would be large animal testing, but the FDA will not authorize large animal testing yet. What have we done in response to this? In March of 2022, a group of parents of kids who have CLN2 submitted a request to the FDA to request more research, more funding, and to allow for further testing for gene therapy for CLN2 patients. The FDA is currently reviewing our request and will respond within 180 days. We currently have a petition started outside of this request to help bring awareness to the disease. I've covered a lot of information today, so I'm just going to do a quick summary. Battens disease is a rare form of genetic disease that is fatal. It is caused by a lack of proper enzymes to dispose of dead cells. Patients will suffer from seizures, loss of motor skills, blindness, loss of cognitive thought, and eventually death. CLN2, which is Lucas's type, is treatable but not curable, but a cure is in development. The question I want you to ask yourselves is, what can you do now? One of the biggest things you can do for us is spread awareness. I encourage you to tell somebody you know about what you learned today to help spread awareness of the disease. Something else that you can do today is sign our petition. We have a petition on change.org to help persuade the FDA to approve further testing for the cure. I have provided a link in the PowerPoint. I'll also put a link in the discussion chat. If you have a few minutes, I encourage you and invite you to sign this petition, as you could help save my son's life. Thank you so much.